Thank you very much. So I've got to press this button. Okay, so I'm going to be presenting on behalf of my co-inventor of ClinTrial Refer, Rosla Vistuccia, who's the manager of the Haematology Clinical Research Unit out at St George Hospital, as well as the Haematology Clinical Research Network, the collaboration across New South Wales of all the managers of the different haematology clinical trials units. And in a sense, I could just leave this slide up there and you'd understand it all. We have morphed from what was to initially provide a cross-referral app in the pockets of clinicians to support cross-referral of patients to haematology trials across the state and the ACT, to now having 20 different derivative apps, and are hoping that we may indeed get funding for ClinTrial Refer Australia to have a platform to show all the clinical trials conducted in Australia. So why do we do this? Our problem in 2013 were really multifold. There were significant challenges recruiting patients to clinical trials. We have a very broad spectrum in haematology of quite rare cancers. Obviously, we're all familiar with the geographical challenges that exist across the state of New South Wales, but perhaps the biggest barrier was that the clinician didn't know what trial was where. And there were also two assumptions: that haematologists would not cross-refer their patients to another haematologist to participate in a trial, and that patients would not be willing to leave their own doctor and travel to a different hospital. So to challenge those assumptions, we developed a free, it had to be free, app to download in the pockets of patients, in the pockets of doctors, in the pockets of clinical trial managers to facilitate patient cross-referral to New South Wales haematology trials. And as secondary aims, we wanted to measure the app's uptake and effectiveness, the rates of cross-referral, the recruitment rates to trials, the haematology trial unit staffing, and indeed analysing app metrics. And it was only actually later that we, these are terribly dysmorphic, these slides, I do apologise. It was only actually later that we also had the objective to branch out to other clinical trial platform networks. So we went and developed this mobile app, which was free, simple and effective. We went live on Google Play and iTunes in June 2013, and the app is essentially searchable by four filters that you see up there: disease, location, trial status and sponsor. And by far and away the most commonly used filters are disease and then location. Now, what makes it so effective is that we can have real-time data entry into a very simplified back-end database that ensures currency of information. So as soon as a trial is open at any site, with a push button, we can notify that that trial is open. If, say, for a phase 1 trial is halted to recruitment, we can take it off the app temporarily until recruitment reopens. And the other thing that ensures its accuracy is the cooperation between the trial unit managers to ensure that comprehensive data is delivered to the central app manager. And the app manager spends about a total of about 30 minutes a month updating this particular app. So when you go into the app, you select your disease and click on search to see what trials are currently recruiting. And you can see the different trial details, a trial summary. So you can see there, I'm very sorry, I don't know, do I have a pointer? Is that pointing for you? No, there's no pointer. But I think you can see at the bottom of the slide there that you can see the inclusion and exclusion criteria. There are two key bits of information that are provided to the clinician trying to identify whether their patient is eligible for the trial. and then you can actually identify who at that hospital to contact to inquire about cross-referring your patient. We also have push notifications within the app to let clinicians or app users know about new trials as they open. So this slide demonstrates our primary endpoint. And you can see that over the 4 years that we have been collecting cross-referral data, that there were very few cross-referrals across the state until June 2013 when ClinTrial Refer went live. And what you can see there is that there was an instant and a sustained. It's been sustained for years, and I can tell you it's been sustained to this very day. A 9-fold increase in cross-referral of patients to clinical trials. And the highly critical amongst you will notice that there's a little of a blip of a downturn in every year. And that's in December when the haematologists tend to go en masse to the American Society of Haematology meeting and also take a little break over Christmas. That's my hypothesis anyway. Now, our secondary endpoint's also very, very important, and you can see there that we have had a 64% increase in patient recruitment to our trials over the last 4 years, and a 60% increase in clinical trial staff. And not only have we increased staffing, but we're retaining staff because we've got happy data managers, happy clinical research study coordinators, because that trial with rare T-cell lymphoma, where they're doing protocol amendment after protocol amendment without actually recruiting a patient, they've now recruited 6 patients to because the patients have been referred across the state. Here's now, I think, an outdated image of the patients being cross-referred across the state. And also I want to show you that ClinTrial Refer is indeed a template for many other clinical trial portfolios. And I want to show you here a particular pleasure of mine was to sign the contract with the French Lymphoma Study Association, who have purchased their own international license for that, and lead the world internationally in lymphoma clinical trials. So we were very pleased to sell them an app. But you may recognise your own cancer group there, the Trans-Tasman Radiation Oncology Group, the Australian New Zealand Urogenital Prostate Cancer Trials Group. We've got a breast cancer app coming on board. And I'm going to tell you a little bit about ClinTrial Refer Melanoma in a little while. But also we're now, because it's a template for any clinical trial portfolio, we're actually reaching out beyond cancer, and the Sydney Health Partners app, which will show cardiology, rheumatology, inflammatory bowel disease and cancer trials, all trials across the 4 hospitals and in partnership with Sydney University, will be launched in October. Here is ClinTrial Refer Australia and New Zealand, because having captured every state in Australia and also New Zealand, we're actually able to provide the first ever national database for currently recruiting haematology trials. But the ClinTrial Refer Melanoma is quite an amazing story. The Melanoma Institute purchased a license for an app, and when I say purchased, we're effectively giving them away because we really want to meet our primary endpoint of increased cross-referral of patients to trials, whatever the portfolio. And this is a poster of their presentation at ASCO, the American Society of Clinical Oncology meeting in 2016. And they had an instant 127% increase in recruitment to clinical trials at the Melanoma Institute. And all these new melanoma drugs were available in the couple of years before their app went live. So we do believe that that marked increase in cross-referral for participation was because of their app. And starting from one individual site, they now actually have 40 different national and international sites recruiting to melanoma trials, including MD Anderson and Memorial Sloan Kettering in the US. But the thing I love most about the ClinTrial Refer Melanoma app is it was driven by a rural oncologist, Rob Zielinski there. And I've just circled the key message. I clearly do not want my rural patients to miss out on key trials testing novel agents, and I use ClinTrial on an almost daily basis. So Rob, faced with all these sunburnt farmers with melanoma out in the Central West, really was far too busy to find out where on earth he was going to send his patients to participate in clinical trials. But Rob's gone one further, and I'm delighted that soon we'll be launching ClinTrial rural New South Wales in the pockets of the GPs so that they will know what cancer trials, what diabetes trials are actually being held locally. And similarly, beyond cancer, we're looking at a licence for digestive diseases, for the inflammatory bowel diseases. Our secondary endpoint, one of our secondary endpoints was app usage metrics, and you can see there that we have, for the New South Wales haematology, we have 6,000 users, over 37,000 sessions. Our users are fast. They're in and out within a minute and a half. They get the information that they want. But the most important metric here is this one, where 84% of our users of the app are return users. We've won numerous awards and abstracts, but the only one that's really given us any money was winning $50,000 US dollars for a Clinical Trials Innovation Prize, and that sort of helped keep us alive. We've developed a website. But I'd also want to say that it is not just about the app. In fact, it's really not about the app at all, but the fact that the app is a tool for culture change and for the collaboration it generates, bringing down the silos between hospital and supporting cross-refer. And we believe it has the potential to do so much more, and we're looking forward to ClinTrial Australia and potentially using the app and the website as a means of capturing recruitment metrics that our service providers so dearly wish. So to conclude, ClinTrial has really been a strategic difference in the way that data is collected and presented to the people who need that data. It's significantly enhanced clinical trial cross-referral, recruitment and trial unit activity in New South Wales and beyond. It has increased patient access and Australian researchers' contribution to clinical trials and has been adopted successfully over numerous other geographic areas and disciplines. And I would like to thank you all for your attention. Thank you.